Good afternoon and welcome to this community briefing on our ongoing pandemic. Providing interpretation for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. Unfortunately, we continue to have a high number of COVID-19 cases, and our hospital situation is critical. The number of COVID-19 patients currently hospitalized locally is averaging more than 100 per day, which is severely straining our hospitals and their staff. This is impacting access to care for our residents as well as patients from other communities. We have representatives from both hospitals here today to share some of the actions that they've been taking to address this urgent situation, what could happen if the situation worsens, and how we, the public, can help. But first, let's briefly touch on what the data is telling us. Since November 1st, our 7-day rolling average of new daily cases has been at above 100. This chart shows the steady increase in December, the brief decrease over the Thanksgiving holiday when testing was less available, and then the sharp jump to 182 cases per day on December 5th. The jump was due to the virus spreading at gatherings over the long Thanksgiving weekend. Since then, we did see a very slight decline to an average of 142 cases per day at the end of last week on December 10th. You can see that even with the latest decrease in cases, our average is still higher than it was before Thanksgiving. In addition to the increase in new cases, the positivity rate has continued to rise as well. On December 4th, the rate had reached 14.7%. At the end of last week, ending December 11, the rate took a small drop to 14.2%. We continue to watch the positivity rate very closely. With this high percentage, it shows the risk of transmission in the community is very high. Our COVID-19 hospitalizations have also been high since late October. The 7-day rolling average of COVID patients hospitalized locally was in the 90s for most of November and has been above 100 patients since December 1st. In the last few days, we are seeing the impact on our hospitals from the post-Thanksgiving bump in cases. Local hospitals reported 121 COVID patients yesterday and 125 today, with 18 on ventilators. 84 patients, or about 67%, are from Lancaster County. We are not reporting any deaths today, but our community has lost 16 residents to COVID-19 in November, and 11 residents have died from the virus so far in December. The risk dial will remain an elevated orange for this week. And as we've said before, orange means that there is a high risk of COVID-19 spread and impact on our community. As we and members of our medical community have continued to share, COVID-19 is having a severe strain on our hospitals and the people caring for our loved ones. Joining us today is Derek Vance, CHI St. Elizabeth and Nebraska Heart, and Russ Grenwell, President and CEO of Bryan Health. Both Derek and Russ will provide an update on the critical situation hospitals are facing and what actions they're taking now and what further actions they may need to take if the situation doesn't improve, and tell us how we can help. Let's start with Derek, and then we'll hear from Russ.
Thank you, Director Lopez. Good afternoon. When I was here last, a couple of months ago, I talked about the strain that our health system has been under since early summer. That strain continues and has only intensified. In the past month, the number of COVID cases at our hospitals has more than doubled. But it's not just COVID cases creating that strain. Our labor and delivery floor has seen record deliveries these past few months, with the neonatal intensive care unit using almost every available bed. The number of trauma service patients coming to St. Elizabeth continues to increase every month. Last month, we saw our highest number of walk-in chest pain patients at Nebraska Heart since it opened its doors in 2003. Our surgical cases have been the highest we've seen in years. Every day, on the day prior to surgery, we analyze the surgical schedule to determine which cases we can accommodate and which we cannot. During the pandemic, many patients, of course, have understandably postponed their elective surgeries, and in many cases, those surgeries have become urgent and even emergent at this point. Our emergency room has become a holding department for patients waiting for a hospital bed. At times, half of our ER rooms are being held with patients being held over because they are too sick to be sent home and no beds available in the hospital. In fact, patients are often in the ER multiple days waiting for a hospital bed to open up. That is not the kind of care that Lincoln is accustomed to, and it's not the kind of care that we want to be providing. Available critical care beds are our greatest concern. Our ICU and PCU units have been completely full for months. At any given time, we have approximately 10 ICU patients in our system waiting for a critical care bed. Every day we make choices about who can get care and who can't, which patients are critical enough to get a critical care bed, and who has to wait. And when it comes to these critical care beds, these are life and death decisions. I'm very concerned about what the next days and weeks and even months will look like for us in healthcare. We are just beginning to see flu cases now, which will only exacerbate the current situation. No one wants to ration care, but that is where we are, and my fear is that it will only get worse. So what's the ask? It's a very similar ask that we've had all along, and that is, if you're not vaccinated, please get vaccinated. If you're eligible for a booster, please get a booster. They're very available here in Lincoln, as are all of the vaccines. If you're sick, isolate yourself from others, and particularly large gatherings. In short, know that the pandemic is still going on, very much going on, and behave accordingly. Thank you.
Good afternoon, I'm Russ Grunewald, and thanks, Derek, for those comments. They were perfect. They mirror exactly what's going on at our hospital and exactly our ask. I have a couple of charts here to show where we're at. In this first chart, you can see that we are at a sustained peak. We have been now for quite some time, 3.5 months or so, and we thought we were maybe just barely seeing a little bit of a drop last week, and in fact, we've popped right up to the highest point that we've been since last December. So it's a year ago since we've really seen these kinds of numbers. In the next slide, you'll see the present situation at Bryan, and that the number of folks who are today in our beds for COVID, of the 80 folks in our beds, 3/4 of them are unvaccinated. You will see a new group in there. They're the folks who've had a booster that are in the hospital. And it's worth just stopping on that for a second. Those that are had a booster that are in our hospital, all 4 of those are immunocompromised individuals. And the message there is that this isn't just about any one individual. Even a booster doesn't take care necessarily of all of the immunocompromised folks. The only way we take care of that is if we can in fact decline the whole spread across the whole community, and that's what all of us have to be able to do together. You can also see that in the age breakdowns, again, largely unvaccinated with a handful of vaccinated folks. On the next slide, those receiving mechanical assistance, 2 out of the 12 are vaccinated. All the rest are unvaccinated. You can see none of the ones with boosters are receiving mechanical ventilation at this time. But it's also interesting to note that the age breakdown on ventilators skews much younger than ever before. So we continue to see that. And the last slide shows, similar to what I showed last week, that we are continuing above our normal staffing. We are in surge staffing, which means we're doing all of this additional staffing with overtime, mandatory extra shifts, and now about 100 traveling nurses. Again, at the highest point from a COVID standpoint that we've been in a year. So where does all of this lead us? Well, much in the same way that Derek mentioned it a second ago. We are looking at these things on an hour-by-hour basis. We talk a lot about crisis standards of care. There's been a lot written about that. But in fact, while we don't have a broad crisis standards of care policy in effect right now, care is being determined on a one-to-one basis every hour. We're looking at who can take the next bed, who gets into the ER, who gets out of the ER. All of that is happening really on an hour-by-hour basis right now. This is not happening just in Lincoln, and I'll tell you that with the surge that we're seeing in Omaha, really a phenomenal surge in Omaha, it's very disconcerting to us. We don't know if we're at a point where we could be heading back down, plateauing, or maybe even needing to prepare for an additional surge. So what are we doing? We're continuing to bring into more isolated units, dedicating units for isolation. We are in fact canceling many elective surgeries already, but that's really the next step, is canceling even more elective surgeries, which is kind of an odd thing because St. E's and Bryan have been canceling elective surgeries really for the last 3 months to some degree. This means that almost all of these folks aren't waiting 30 days, which is many times what's determined as the time frame for whether something is elective. They've really been waiting months. And so they're really not elective any longer. They're only elective in name. They really are necessary. So there's not as much potential capacity left like we would have had last winter. We are looking at closing additional hospital units and deploying staff to COVID units. It's very limiting today to transfer folks in from the greater Nebraska area into our hospitals. We anticipate that getting even more problematic in the future. So again, what's our call to action? Listen, if you can get a booster, please get a booster. We know Omicron's coming our direction. There are hotspots today in New York and in Ontario and other places. And that's coming here. I don't know one medical professional who doesn't believe it's coming here. It's coming here. And what we do know is that without a booster, with 2 shots but no booster, you're 30 to 40% effective against Omicron, 70 to 80% effective with a booster. Please get a booster. We don't know the severity of it yet. We do know the transmissibility is very, very high. Anyway, that word. We know how severe it's going to. We don't know how severe it's going to be. But we don't really want to find out how severe it's going to be. Kids, we can't think of a good reason for you not to get vaccinated. Please have your kids get vaccinated as well. And of course, holidays are coming up. As you can see, the current surge, based on what happened over Thanksgiving, we're concerned about what will happen over Christmas. Again, please monitor your health carefully and be careful around others. Thank you.
Thank you, Russ and Derek, and thanks to your dedicated teams at the hospital who continue to provide round-the-clock care to patients during these very challenging times. We all have a role to play in helping our medical community and improving the situation by getting vaccinated. Again, state data tells us that unvaccinated Nebraskans are 10 times more likely to be hospitalized than people who have been vaccinated. The more people who get vaccinated, the fewer potential patients we will see in our hospitals and the fewer members of our community we will lose to COVID-19. We do have some positive news in that area. The latest vaccination data shows a recent uptick in the number of local residents being vaccinated. Over the past 4 weeks, we have averaged about 3,300 doses per week. That's up 38% from the 2,400 doses we averaged in the 4 weeks before that. I want to thank our residents for being part of the solution, for stepping up and rolling up their sleeves to get vaccinated. Last Thursday, the Centers for Disease Control and Prevention announced that booster shots were approved for teens ages 16 and 17. The very next day, we began offering booster doses to this age group at our clinics. A booster dose boosts the existing protection a person has against the virus and its variants. 41% of our residents aged 16 and over have now received a booster dose or a third dose. 63% of all Lancaster County residents are now fully vaccinated, and close to 28% of children ages 5 through 11 have now received a first dose, and over 17% are fully vaccinated. And joining us today by Zoom is Dr. Erin Schmidt, a pediatrician with Lincoln Pediatrics. She will share some key information about COVID-19 vaccination for children and tell us some of the common questions and concerns she's hearing from parents. Welcome, Dr. Schmidt.
Hi, thank you. So I would say by far the most common question that I get from parents is just general. So what do you think? Do you recommend it? Just very vague, general questions. And I think that just shows how much our parents in our community just want to hear from their doctor. They want to have a conversation and hear what your doctor recommends. So I would say by far, I hear that more often. And it's a great opportunity to answer more specific questions and to give, for me as a clinician, it's our job to educate and present the data and help our families and our patients make a well-informed decision. More specific questions I've heard before are, well, what about the side effects? Whether it's from the myocarditis questions or getting a fever, getting sick from the vaccine. I hear those questions. And in general, the pros of getting the vaccine definitely outweigh the harms of getting a COVID infection. And I feel like I can't say that enough, although it's great to have that opportunity for people to ask questions. Some more recent information I've heard specifically about the myocarditis, which is probably the more serious side effect people have questions about, is that in a study of thousands of people, myocarditis happened in vaccinated people, 0.00004% in people that got the vaccine, whereas somebody who got a COVID infection, it happened about 0.001%. So sometimes just showing those numbers help people realize that the vaccine is safe. And it is available for anybody that's 5 years of age and older. So my short answer when people ask me, what do you think? And I definitely recommend it. I've given it to my own kids who are age eligible and my own family. And so I just strongly feel that these vaccines are very good and they're very safe, and they are probably the most effective medical tool that we have available. And I just hope that everybody can ask their own doctor as many questions as they'd like, and contact your own doctor and use your resources.
Thanks again for joining us, Dr. Schmidt, and we appreciate the partnership with our local pediatric practices that have helped to vaccinate and protect the children in our community from COVID-19. Vaccine is now available to most residents in our community, as Dr. Schmidt was saying. Everyone 5 years old and older can get vaccinated against COVID-19. Everyone 16 years older and up can get a booster dose if they completed their initial series. As I mentioned, 63% of all Lancaster County residents are now fully vaccinated. That leaves around 23% of our 73,000 people age 5 and above who have not yet received vaccine, and around 7% are 23,000 children under 5 who are not yet really eligible for vaccine. If you haven't been vaccinated against COVID-19, Let me reiterate some of the benefits. Vaccination helps prevent severe illness, hospitalization, and death. It helps protect you, your loved ones, and our community. It can help ease the strain on our local hospitals. If you're fully vaccinated, you can self-monitor instead of quarantine if you've been exposed to someone with COVID-19, as long as you don't have symptoms. A higher vaccination rate can help slow the spread of the virus, which can limit the number of variants that come forward. The latest variant of concern is Omicron. Since the first case was confirmed in California on December 1st, it has been found in 30 states, as Russ Grunwald was mentioning, including Nebraska. And some experts expect case numbers to keep rising. You know that we had 6 cases reported in southeast Nebraska on December 3rd. We've had no additional cases reported in Lancaster County or elsewhere in the state as of yet. We're working to further understand Omicron and its potential effect on Lincoln and Lancaster County. Medical and public health experts are just beginning to learn how it may respond to current treatments and vaccines. They're actively studying the new variant and its impacts in Africa and Europe. As we're on the lookout for Omicron in our community, we continue to deal with the impact of the Delta variant. Our current situation again is that COVID-19 cases are high. Our hospitals are severely strained. The holidays are approaching and the variant could be detected locally soon. On top of that, other respiratory viruses like flu are ramping up. This evolving situation underscores the importance of vaccination, boosters, and other preventative actions. We urge all those eligible to get vaccinated or a booster dose now. With every person who gets vaccinated or boosted, our protection against the virus is strengthened. And this will better position us as individuals and as a community for what may come in the weeks and months ahead. We continue to hold several clinics each week at the health department, and we continue to work with partners to hold additional clinics in the community to make vaccine available, convenient, and close to home. If you're eligible to get vaccinated or a booster dose, you can schedule an appointment at an upcoming clinic at covid19.lincoln.ne.gov. Local pharmacies are also offering vaccine, and you can find a location by visiting vaccines.gov or texting your zip code to 438-829. This year, one of the best gifts we can give ourselves, our families, and the community is protection from COVID-19. So get vaccinated or boosted and wear a mask. And with that, we'll take questions. Okay, so thanks again for joining us today.